Function with Purpose Podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 12, Episode 5 of the Function with Purpose podcast. Dr. Amy here, your host, and thanks for tuning in today. I greatly appreciate it. While you're here, go ahead and give me a follow on your favorite podcast app, Apple, Google, and even the Fortress PT YouTube channel. A lot of content on there that I'm slowly building over time. All right, we're going to get right to it. Episode 5 of Season 12, today's podcast, selecting or choosing the right movements when you're in pain. So, I will go over an example. We'll probably use an example for the shoulder joint and some things that one can incorporate or at least think of when you're recovering or going through an episode of pain or discomfort that limits you to perform certain movements in the gym, the CrossFit space, even your garage gym, etc. So from the PT perspective, when patients seek out help from me, or some other colleagues that kind of had the same similar setup as myself, usually they seek out help because they sustained an injury or experience pain that is affecting their capability to perform fitness or exercise or lifting, which then can in turn affect their activities of daily living. So, cooking, cleaning, driving a car, etc. So before I kind of dig in on some key things to incorporate or manipulate from a physio perspective, and even from a patient perspective, because this is something that you might try on your own before really seeking out help from a physio, right? Because when it comes down to it, the patient has the baton, the patient has the power, and I'm definitely an advocate for those who are unfamiliar with fitness to seek physio right away. But if you've been in like the fitness space and your training age per se, you've been in the game for quite some time, this is just some considerations that are very advantageous and to keep you moving while you heal. Now, I do want to note, disclosure too, that a lot of times when patients do seek out physiotherapy, in this particular kind of episode, it's pertaining to musculoskeletal issues, meaning muscles, tendons, joints, ligaments, which then in turn affect movement. So I want to be clear on that. This isn't like, someone is experiencing unrelenting pain and, they have to see physical therapy first before going to the emergency room. No, we're not talking about that. We're talking, maybe an example is a patient was performing a power snatch, which is an Olympic weightlifting movement, and they felt some immediate pain in their left shoulder. So stemming off of this example, supposed mechanism of injury is utilizing or performing a barbell snatch, working up to a heavy load for the day, and something just kind of felt off, that the patient was experiencing pain at the end of the day when they were getting ready to go to bed. So, patient comes in, as an example, and We gather some baselines. We really dig in on this proposed mechanism of injury, right? Supposedly the barbell snatch, that increased load could have played a role. Perhaps their snatch pattern or the movement integrity got off kilter, or perhaps there was something a week prior that led up to this. Maybe there was a little niggle that was slowly building over time, and then the power snatch movement was what really kind of what was the threshold. So selecting or choosing the right movements when you're in pain or when the patient is in pain is super important when they come in for their first physio visit. So we always want to dig in on, okay, what led up to the event itself, and what did you do afterwards? So in a sense, we're trying to develop the plan of care, right? The plan of care that doesn't tell the patient or inform the patient that they quit doing what they're doing, i.e. fitness, exercise, resistance training, aerobic capacity, etc. So during that initial evaluation or assessment, both myself, the physio, and the patient, we have to figure out a game plan that will help them stay in the game and keep them invested, right? So, of course, this patient wants to get back to power snatching and wants to eventually increase his 1 rep max. So something like that takes time. But he wants to return to power snatch. But every time he does that snatch motion, which you can kind of look that up on Google, but I can totally put a link into what a power snatch looks like. His left shoulder just does not feel right. Something feels off in that rotating position and then in that catch position. So first and foremost, when selecting the right movements when a patient or if you're in pain, is what aggravates it, what makes it better. So those are things that must be established in your mind and within the physiotherapy session. So some things to initially manipulate off the bat is changing the range of motion pattern. So this is where I like to bring in some perhaps stabilization exercises or some plank variances. Again, we're going to be talking about the shoulder, where we have what we call an open kinetic chain, where in instance, perhaps the patient is holding a kettlebell or dumbbell away from their body, and they're holding it in a static position. That would be an example of an open kinetic chain movement. A static hold, the hand is quote unquote floating in space. It's not connected to something that's stable. And they're trying to really engage the whole arm complex, as opposed to the flip side, incorporating perhaps a plank variance where maybe they're in the tall push-up plank position. Their arms are locked out at the top of a push-up and they are kind of rocking back and forth. They're lifting one hand up, getting 100% weight bearing on one side, switching, they're rocking over to the other side, the affected left arm, and they're trying to tolerate some weight bearing through that arm. So one of the first things to manipulate when you're selecting the right movement is an incorporation, in my eyes, an open kinetic chain or a closed kinetic chain movement. Something that doesn't irritate the tissue super much, if that's a phrase, super much, but it kind of challenges the tissue per se, right? So in this case, perhaps the rotator cuff complex. And getting report within the moment and 24 hours later what the patient experiences. Did that really shoot up the pain and discomfort immediately to like a 10 out of 10 where he's like, oh my gosh, cut my arm off, I can't do it. Nope, not happening. And he's verbally telling you that versus, you know what, this is tolerable. Like, I can do this. I can do a little more of this. I can do a couple more reps. So the irritability of the tissue and what you do is kind of codependent upon each other, right? The more irritated the tissue is, the more that we need to back off the intensity of the movement. If it's not as irritable, then we can make the movement a little bit more difficult in order to achieve the desired dose and response that we want. So first and foremost, when a patient comes in and we establish baselines, I need to give him or her some movements. I usually like to do an open kinetic chain and a closed kinetic chain, a low threshold movement that creates buy-in and it gives them control, right? So as a patient is perhaps progressing in the right direction where tissue irritability is decreasing, it takes a little while for that irritation to kick in. They want to get back to power snatch, but they're totally not there yet. They can't even still put that barbell overhead or tolerate that rotation position. So we just change the range of motion pattern. That's probably one thing to kind of quickly adjust, right? Changing the range of motion. So in this case, the power snatch, maybe I will have the patient have have to perform a banded upright row, right? Slow and controlled. This is where we can add another component, a tempo speed. Slow and controlled upright row, pause at the top, slow and controlled upright row, bringing it down towards the hips. So we're mimicking that power snatch or that high pull position, right? But we're stopping there. We're not getting into this external rotation position. So we're just going to take perhaps these portions of the power snatch points of performance, and we're going to incorporate banded work, or maybe it's light dumbbell movement. That upright banded row, we could do dumbbells with that, a lighter dumbbell with a tempo. If that's aggravating, then I'm going to switch to bands because it's not as, I guess, tensioned, right? As in gravity plays a role with certain angles, but the band is typically a little bit more tolerable than lifting an external load of a weight, dumbbell, kettlebell, yet alone barbell. So this leads to my next point, right? The external loading, changing the load or changing the apparatus that you're using. So in this prime example, if someone who performed a power snatch with the barbell, that was the apparatus or the external load that they used when they really irritated the left shoulder, I'm changing that load apparatus. Bands, kettlebells, dumbbells. It could be the PVC pipe or a broomstick where it's significantly lower weight, but we're still going to try to break down that movement pattern, right? And don't forget what I said before. Yes, I'm going to slowly reintroduce that movement pattern and break it down to its points of performance, but I'm still adding some or incorporating that open kinetic chain movement, that closed kinetic chain movement, right? Static holds, carries, some bodybuilding type movements. Right? Using some type of buy-in, and we're still building upon each other, right? Because I'm always looking for how much can I do, which then leads to my progression of the movement choice in response to the irritation of the tissue, i.e. rotator cuff complex. We're talking about the shoulder today. So changing the range of motion adding a tempo or speed, changing your external load, still incorporating that open and closed kinetic chain movement. Perhaps maybe the next thing, maybe we add some type of assistance or support with the power snatch. Maybe we add or change our loading position. Maybe we're laying on our back with a PVC and we're practicing that upright row, little slow controlled rotation towards our face, and then pressing that PVC overhead, coming back down into that high scarecrow position, rotating into internal rotation, that PVC back down to our mid-chest, and then bringing that PVC back down to that start mid-thigh position, all while laying down on the floor. So now we're incorporating the actual movement, but in an anti-gravity dependent position. Hey, how did that feel in the left shoulder? Oh, you know what? The rotation felt pretty good there. Okay, all right. Well, guess what? We're still going to lay down. We're still going to do the PVC, but I'm going to add a little band to this. I'm going to hook up a band around your feet, which then is attached to the PVC, and you're going to add some external loading with a band in that, i.e. Cuban press position or high hang power snatch slow controlled position. Man, I'm hitting all those points before. Range of motion pattern, tempo, speed, my external loading, in this case PVC and a slight light band for resistance. I'm using assistance or support, right? I'm laying down on the ground. That's the assistant or support. And I'm choosing, i.e. that unloaded position, and then adding that slow controlled tempo manner. How cool is that? So, we're always, as a physio, always figuring out the response to what we do with the patient, right? A particular movement responds how? This is where you need to ask the patient. I like that red light, yellow light, green light analogy. Are you green? Green means go. Yes, I want more. I can do more. Yellow, I could do a little bit more, but let me maybe stick to the same rep scheme in volume. Or red, oh no, I am hot right now. That does not feel good on my shoulder. So this all gives you that data, right? And last and foremost here, I think one of the main things when someone comes in and you're trying to find the right movements when someone's experiencing a bout of pain, in this case, in this example, left shoulder pain, in the power snatch they can't do with the barbell with 95 or 125 pounds, but we're trying to slowly incorporate that movement pattern back in. I think one of the biggest things that we miss to relay to our patients is utilizing cardio within their rehab. So what do I mean by this? What I mean is the use of a rower, maybe a ski erg, a Concept 2 bike, or a Rogue Echo bike, or an assault bike, or it could just be a Peloton bike. It could be walking or jogging. It could be shuttle runs. It could even be jump rope. I think one of the biggest things that we miss is some piece of cardio that gives input to the heart, right? Jacks the heart rate up in order to create this, what we call this global pump. So when the heart is pumping blood throughout the entire body, we feel better. So why not incorporate that into someone's rehab prescription plan or home exercise program? Man, no matter what of these previous key concepts to incorporate or manipulate, right? Changing the range of motion pattern, changing the tempo or speed, changing the external loading or even the patient position, right? Adding assistance or support, adding more carries or holds, that open kinetic chain, that closed kinetic chain. Add this last component, add some type of cardio bout. It could be, I don't know, maybe a 500-meter row, if that feels okay on the shoulder. You could do a 500-meter row, then you go into the tall push-up plank, alternating hip taps, right? Then you can go into the laying on your back, PVC, snatch pattern, controlled tempo position. Then you can rest a minute after and then go back into a 400-meter or 500-meter row and repeat said movements. How awesome is that? I wonder if you do something like that and then see how you feel going into the night to prep for bed, and then especially the 24-hour response later. I guarantee you'll have what we call in the PT research world, a meaning clinical difference. Meaning somewhere between 20 to 50% improvement. If you incorporate things like that into a rehab routine, that is what helps the patient when they come into your office, help them select the right movements when they're in pain. Yes, at the beginning, we're establishing our baselines. We're taming the symptoms. We're calming the symptoms down. But then we have to reintroduce movement as quickly as possible. Sometimes it might just be one movement, right? Maybe it is the tall plank weight shifts. Can they tolerate that? Are they in good hollow body position? Are they squeezing their butt? Are they locking out their knees? Are they staying hollow? Are they really pushing through the floor and then some? Right? And then you can add maybe a 1K C2 bike. 1K C2 bike, max effort plank hold at the top of the push-up. Rest 30 seconds, repeat 5 times. There you go. That's your rehab prescription. Make it unboring. Oh man, selecting the right movements when you're in pain. Whether you're a seasoned veteran athlete or someone who's been in the exercise space for quite some time, these are definitely things to consider. Or if you're a newbie, for sure, if you're a newbie, I highly suggest getting into PT ASAP because this is a learning process. And this is something where seeing a PT ASAP will help you stay in the fitness space instantaneously, right? Because the fitness space or the gym is part of or an extension of your rehab. That's where you do your rehab, right? So just to reiterate some key things when a patient perhaps comes in with a shoulder issue, or if you're a seasoned veteran and maybe you experience a shoulder niggle or pain or a tweak, you might try some things on your own before seeking out PT to get you to that next level, right? First and foremost, we need to establish baselines, tame the symptoms initially, and then we need to incorporate or manipulate the movement pattern, right? The range of motion. Maybe we do partial range of motion. And then we change the speed or adding a tempo to this. Slow and controlled. This is where bodybuilding comes in. I love it. Changing the actual external load. Instead of using a barbell, which in my example, a power snatch using a barbell was the issue, and that's hard to control. We use bands, dumbbells, kettlebells, a PVC pipe, right? We can use assistance or support and then change our position. Maybe we do things laying down on the ground first. Make it easy, make it less irritable. And then we can add some more carries and holds, right? heavy kettlebell holds, heavy kettlebell front rack carries. And then the biggest win of all is creating that full body pump with some type of piece of cardio within your rehab routine. Run, bike, ski erg, row, walk, jump rope, right? Pump the heart so the body knows where to push the blood to the area that's in need. It naturally knows it. That's how robust our body is. So hopefully this gives you some intel and details that when and how to select the right movement when you're in pain or an episode of pain, right? And know that physical therapy is there to help. Physical therapy can be an option to help open your eyes to different avenues. And then don't not quit the gym, right? Like, the gym is an extension of your rehab environment. Use it. That's what it's there for. That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.